If you've been prescribed several medications to reduce prolactin without success and have given up, I'll show you how women in my program get pregnant naturally with a mix of herbs, supplements, diet, and lifestyle changes. Please don't get me wrong, these medications often prescribed work for some people quite alright. However, in some others, I've seen it crashes prolactin for a while, after which it starts to come up again. Now, my natural methods reduce prolactin gradually and the results are permanent. I've had countless number of women with high prolactin get pregnant naturally in my program. But for time, I'll share a few starting from those with the highest level of prolactin I've ever worked with. So if yours is lower, which is the case most likely, you know it's possible for you too. So before we get to treatment, it's important to have an understanding of how prolactin works. What is prolactin?
Hello, my name is Onome Stephanie Inyong. I'm an internationally certified women's holistic hormone health practitioner. Basically, I help women navigate hormonal imbalance from finding the root cause to providing personalized treatment plans to regulate periods, improve reproductive health, and aid conception for women trying to conceive. I'm also a member of the International Practitioners of Holistic Medicine in the United Kingdom and the founder of Women's Health Platforms Foundation, an NGO clinic in Abuja, Nigeria that has provided thousands of women with low-cost and affordable preventive healthcare services.
So prolactin is a hormone produced by the pituitary gland, a gland at the base of the brain. It's meant to be high in women who are pregnant or breastfeeding because it stimulates the production of breast milk. So there's a series of reactions that go on to make this possible, but I wouldn't bore you with that. Instead, I'll show you how it can affect your fertility. So how does prolactin affect fertility? When a woman is not pregnant or breastfeeding and has a high level of prolactin, it will be referred to as hormonal imbalance. When prolactin is high, it can stop ovulation or affect the quality of ovulation because the body is in a state where it believes it's either nursing a child or preparing for one. So a signal is sent to the brain to stop the production of reproductive hormones. First, it affects the production of gonadotropin-releasing hormone, that's the GnRH, which then reduces the production of follicle-stimulating hormone, FSH, and luteinizing hormone, LH, both of which are responsible for the maturation of eggs in the ovaries and ovulation. So basically, until prolactin comes down, a woman will struggle with not ovulating or getting pregnant. This is the reason why women who exclusively breastfeed do not get their periods or ovulate, and most especially do not get pregnant. It's the same reason they also experience low libido. Makes sense now, right? So some women will say, but I don't have discharge from my nipples. I want you to know that not every woman with high prolactin will have discharge from their nipples. Personally, when I was trying to conceive, this was the case with me. I was diagnosed with high prolactin, but I had never seen discharge from my nipples. So what is the normal level of prolactin to have a healthy ovulation and regular periods? It should be less than 18 nanogram per ml or less than 400 micro IU per ml. Now we move to the cause of hyperlactin. What is the cause of hyperlactin? So there are different reasons ranging from non-cancerous growth in the pituitary gland called a prolactinoma. This could be the case when prolactin is extremely high. There's also hypothyroidism, taking herbs like fenugreek, fennel seeds, stimulating the breast often, and this could be having the breast sucked often, kidney or liver diseases, taking certain medications like antidepressants, and some for blood pressure regulation. Now, the good news is high prolactin can be treated. So let's start with the first lady I worked with the highest level of prolactin. Her name is Chiwendu, and we started working together in 2024. When she reached out to me, her prolactin was about 158 nanogram per ml, and the normal level is meant to be 18 nanogram per ml, right? You can imagine how high. So at the time, her periods had ceased, but I encouraged her because I believed in the process. Well, she signed up for a consultation in September. She had taken several medications, still no changes, right? Because her periods were ceased. So she would usually use medications like Primolut to trigger her periods. They'll give her for some days and then she'll bleed after, which is not a real period anyway. So she was worried about this, and I encouraged her to start the treatment and be patient. She only got periods when it was induced. So a few weeks into treatment, she saw fetal mucus, and I told her to expect a period in 2 weeks. And then the periods came naturally for the first time in a long while. We retested prolactin and it was down to 35 nanogram per mil at that point. We tested progesterone as well before the periods. After she saw the fetal mucus, a week after, I asked her to go for a progesterone test, and it was up to 19 from 0, which indicated that she had ovulated in that cycle. We're excited. Prolactin was still high, but it was a long way from where we started. So I encouraged her to continue her treatment. Now, in the next cycle, she ovulated again, and we timed sex correctly using the symptothermal method, a combination of her temperature, cervical mucus, and the ovulation test strips. So when she tested before a missed period, she got a positive, although it was faint because it was still early. And weeks later, she got a positive blood test and is doing very well now. We thank God. So she almost gave up on treatment, but God stepped in, and I'm super excited for her because she had almost given up. In her words, she said, it now appeared as though high prolactin could not be corrected. I saw a lot of gynecologists, and it was frustrating, right? Because she thought her case couldn't be treated. Right. So next I want to share with you is Jennifer's story. I also started working with Jennifer in March 2024. When she signed up for a consultation, her prolactin was 99 nanogram per mil. I had a consultation with her after completing an assessment of her cycle on the 9th of March. She had a history of high prolactin, difficulty sleeping, both of which contributes to hormonal imbalance. Her treatment plan was to improve her sleep, reduce prolactin so she could begin ovulating. And then I ordered a new set of labs, and when the result came back, of course, we got the prolactin that was 99 ng per mil. Her estrogen was also low, progesterone was low, and her LH was elevated. And then she started treatment. The next cycle, she started ovulating. We confirmed from her basal body temperature, just like you can see in this picture. And in the cycle after that, she also began to see egg white for the first time, and she was really excited, I remember. So in the next month, she got a faint positive 12 days after ovulation, and I asked her to retest after a week, which came back with a blood pregnancy test, and that was positive, right after 2 years of trying. So there were times it was really hard on her, but in our TTC coaching group calls and check-ins, she got the motivation she needed to continue. So support is a big part of our program. Now, what are the steps you need to take when trying to conceive with high prolactin? You need to test correctly. When we started this video initially, I talked about the different reasons why a woman could have high prolactin. So there's no one size fits all. You have to know why your prolactin is high, and that would require testing. Right? So very often I see women with incomplete hormonal profile tests. The reason why your prolactin is high could be seen from other hormones as well, and this informs the kind of treatment you need. So if there's thyroid disease, you need to address that too. Testing also helps you know your starting point. So this will help you track progress over time, especially getting to know if your treatment is working for you. Like I mentioned earlier, some women will say, I don't think my prolactin result is correct because there's no discharge from my nipples. You can have high prolactin without discharge from your breast, or have discharge from your breast without high prolactin. So proper testing is really, really important. And sometimes with the regular medications that are given, you might see that prolactin comes down in this month. Next month you go to test again, and then you see it has gone back up. It kind of goes up and down. So testing helps you know what you're doing and if it's working for you. Next, you have to start treatment, right? Every woman is unique. There's no one size fits all, like I've said before. So based on your results, a health history and symptoms will be taken. A natural treatment plan will then be put together for you. This would include what to eat, what to avoid, supplements to take, herbs if necessary, and an exercise guide if you need one. Right? The third step would be to track your cycles using the symptothermal method. You notice in most of the testimonials, you saw something like a graph. It's the daily basal body temperature readings and the most accurate for confirming whether or not a woman ovulated. So if you weren't ovulating before, you then begin to ovulate and see it from your charts that, now I'm ovulating, right? You need to track your cervical mucus as well and add ovulation test strips if you need to. So this will help you know when you begin ovulating again, and it takes an average of 2 months, right, for your body to start ovulating, prolactin to come down. Then the last step, of course, is to time sex correctly at the right time. When trying to conceive, we can be really anxious and want to achieve pregnancy in that instant if possible, but I always advise women to wait 3 months, especially if there's hormonal imbalance. This is to give your body time to build on hormones, improve egg quality, so that when you get pregnant, the pregnancy can be sustained and not risk miscarriage due to hormonal imbalance. I have some more testimonials to show you. Sometimes high prolactin may be existing with other hormonal imbalances or structural deformities, which is why a complete test is important and will guide you through the process. Now, Hope had high prolactin and blocked fallopian tubes. Right at the beginning in August, when she signed up for our program, she had a history of high prolactin that was resulting in low progesterone. Right, so a HSG also showed both of her tubes were blocked. Her goal was to regulate her cycles and clear her tubes before her husband came back in September. And she also had facial hair growth on her breasts, on her chin. I asked for some more tests after our consultation to check her testosterone levels, which came back high as well. So I included all of this in our treatment plan to address these other imbalances, And after 6 months of treatment, the therapies for the blocked fallopian tubes, her prolactin came down, all of that, and she got pregnant in the second cycle after her husband got back. Right? There's also Uyu, who had very high prolactin that caused her early miscarriages, low estrogen, and was also on some prescription medications, right? So high prolactin, if not treated well or addressed well, can cause early miscarriages because it will affect the quality of the egg. Right? She signed up for a consultation in November 2024. Her main issue was high prolactin, like I said, and she also didn't know how to time sex correctly because she didn't know when she was ovulating. I asked for some more tests based on her symptoms. In January, we retested her prolactin and it was down to normal. She was so excited. She also began ovulating and timing sex with our guardians. And in February, she conceived, to the glory of God. She couldn't believe it. Uraula had high prolactin too and was on some medications without improvement. After a few months of treatment, it came down to normal, but there was still delay. And I asked for a semen analysis, which came back very poor. So I gave a treatment plan for her husband, and in a few cycles, she conceived. So she joined the program in July with high prolactin, had been on some medications. After speaking with her during a consultation call, I added some more tests, medications as well, a meal plan, and exercise guide as well. I also noticed she had been given a diagnosis of PCOS, but after her cycle assessment and reviewing her results, I was convinced it wasn't PCOS but high prolactin. So it's not just about you two. Your husband needs to test so that we can offer treatment for the both of you. It takes two to make a baby, and it's very important for the sperm quality as well to be good. So all the details you need to sign up for a consultation and a cycle assessment are just below this video in the description.
In a consultation with me, we get to uncover the root cause of infertility, find out why you're not getting pregnant. I get to review your results personally. If you haven't run the necessary test, I give a list of tests for you to do. Then afterwards, based on the results, I'll give a personalized treatment plan for you and your husband, including all the necessary changes you need to make to support hormonal balance. You'll also learn how to track your cycles correctly using the symptothermal method in order to master your fertile window, ovulation, and the different phases of the menstrual cycle. You also have an option to speak with a member of my team. If you have questions about the program, you want to learn more about the program, get to know if it's the right fit for you, get a quick review of your results, and understand the next steps you need to take to achieve conception based on your results and diagnosis. Until next time, I wish you success in your journey.